When parents hear the word pediatrician, they think of someone to partner with them as their children grow from infants to young adults. They want someone to be there to answer their questions, to support them through this journey, through sickness and in healthy times as well.
And when people think of pediatricians, I think they think of someone who is friendly and approachable and will listen to their concerns.
When a parent comes to the Ohio Center for Pediatrics, they should expect to be greeted by a warm and friendly staff.
From whoever picks up the phone when they place that phone call to call and schedule or to call and ask a question, we want them to hear a smile through the phone. When they come to our office, we want them to see a clean space. Parents can expect to see people who are here to help them, people who are here to listen. We never want a family to feel rushed. We want every parent to feel like they have enough time to ask all of their questions, to feel confident in the answers that they receive, and to feel like we always have a plan going forward.
Our practice really focuses on being very family-centered. The physicians and staff themselves are very family-oriented, and we treat each other not only as coworkers, but as almost family. And we want you to feel like you are part of that when you come to our practice.
You realistically have to treat the entire family, and the physician is just one part of that there. So that's probably the most important thing that I try to keep in mind when somebody comes here.
I think what sets our practice apart is that we provide excellent nursing and triage care for our patients.
We have nurses actually answering the phones. The reason that we do this is that these nurses are actually really good at helping sort of prevent the need to come into our office. A lot of things in pediatrics, time will sort of tell if they need to come in. Having, some of our trained nurses answering your questions will hopefully help, calm down a parent who's nervous. Like, is this something I need to go to the emergency department for? Is this something that needs to be seen in the office? Is this something we can watch even for a couple hours and then bring them in if they need to be brought in?
Our rooms in the practice are all different, representing multiple countries and cultures from around the world, and all different sorts of activities and sports and interests so that every child and adolescent feels welcome here.
My favorite part of Ohio Center for Pediatrics.
My favorite part of being a pediatrician.
My favorite part of being a pediatrician.
My favorite part about being a pediatrician.
My favorite part of being a pediatrician is that I get to come side by side with parents and walk with them as their children grow from infants to young adults.
It's an amazing experience to start this relationship with families when you are initially interacting only with the parents and a child who can't talk to you, and suddenly at the end of the day you're congratulating a child on graduating high school and going off to college.
Really being a big part of preventative care. I really love that about pediatrics, getting to talk to children and their families about different ways they can be healthy for the rest of their lives.
Is of course the kids. They are so much fun and so cute, and they just make my day every day.
Kids will say the darndest things, and that definitely keeps the job very lighthearted and interesting no matter what every day.